Hello, everyone, and welcome to the fifth season of McGill Cares webcast series. And actually, this is our 111th episode. I'm Claire Webster, a former caregiver and certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine, and Dr. Serge Gauthier, Professor Emeritus, the former director of the McGill University Research Centre for Studies in Aging. McGill Cares is supported by the Amelia Saputo Community Outreach for Dementia Care. The McGill University Dementia Education Program offers a comprehensive range of free resources to educate and support persons living with dementia, family and informal caregivers, healthcare professionals, medical students, and the public at large. One of our most important resources is our Dementia Companion Guide, which is now available for free to download in 14 different languages. Printed copies are available on Amazon, and all proceeds go to support our program. And we are also very excited to have recently launched a free new online education course designated to support and educate partners of people living with dementia. The content consists of 10 self-guided online modules that the learner can go through at their own pace. It includes expert advice, shared experiences from participants, and solutions to the challenges of being a care partner in the context of dementia. So please check it out. All of our resources are free. So we have a very exciting first episode to kick off the new season of McGill Cares today. And it's all about modifiable risk factors for developing Alzheimer's and related dementia. In July of this year, the Lancet Commission launched its 2024 World Report on Dementia Prevention, Intervention, and Care. According to the report, 45% of cases of dementia are potentially preventable by addressing 14 modifiable risk factors at different stages during our life course. So I have my wonderful colleague, Dr. Serge Gauthier, who's going to be here with me this morning to discuss all of those risk factors, modifiable risk factors. Dr. Gauthier is a clinical neurologist specializing in the development of new tools for diagnosis and treatments for people living with Alzheimer's disease. He was the director of the McGill University Research Centre for Studies in Aging from 1986 to 1997. Dr. Gauthier is the academic co-lead of our McGill University Dementia Education Program and Professor Emeritus of Neurology and Psychiatry at McGill. His accomplishments led him to being appointed to the Order of Canada in 2014 and the National Order of Québec in 2017. Welcome to McGill Cares, Dr. Gauthier.
Merci, Claire. Good morning to you and to all. Thank you, Claire, for this opportunity to discuss the exciting publication. I'll just show it to the audience. Thank you for sending me a copy all the way from Philadelphia. It's an exciting report, and I'll tell you why. And it does have impact on prevention of age-associated dementia or cognitive decline at large. So this is the overview of the report. It explains, this report, their findings on modifiable risk factors, and this is based on worldwide information. So the modifiable risk factors we will talk about are for the population at large, and I'll highlight some features that are specific for Canada as we go along. Now, the executive summary of that report is here. You can just look at it as I explained that in the authorship. This group is led by Dr. Gil Livingston, an epidemiologist in London, England, but there's a prominent Canadian in the authorship, Dr. Ken Rockwood from Halifax. So thank you, Ken, for joining this important group. And the highlight is two new modifiable risk factors. So 12 move now to 14, and we'll go over them together. The new ones are bad cholesterol, better known among clinicians as high LDL, low-density lipoprotein cholesterol or bad cholesterol, and impaired vision. And we'll look at how much this weigh in the risk factors. There's also in that document other information that we'll go over at other McGill Cares opportunities. So this is in summary what they find, and then we're going to go over each item one by one. So the big view is that you can start preventing late life, over age 75, let's call it late life, changes in your cognition already in school. So low education is considered a risk factor, and there's a number assigned to each risk. So this is the weight, how much this modifiable risk factor is important overall to reduce the risk of dementia in a population. So this is less relevant for Canada, where we have a school for everyone until age 16, but some rural regions of China, Bangladesh, India even, it's still a big issue. So it's as a weight of 5. If you increase schooling overall in a country, this would reduce the risk of dementia in that country 60 years later. Now in midlife, that's important because that's probably most of our audience. Midlife is like 40 to 70. And it's never too late, but sooner the better to modify some of these risk factors. So we're going to go over them one by one, but I'll just show you the order. So you have hearing impairment, which is a big one. It's big because it's so common. And then we'll talk about what can we do about it. And then you have other risks that we will go over one by one. And late life, that's over age 70, 75. There are other factors that also are important. The view is that if you correct for the average person, most of these risk factors, you would reduce the risk of dementia by nearly half. So that's a big deal. It's more important than any medicine that we have or that are under development. A note of caution that this report is for the world at large, and it may be different for different cultures or gene pools, and we'll go over that briefly. Next slide, please, Claire. Now we're going to go over each one. Less education, as I mentioned, is more important in certain countries where especially the rural regions have less access. We could say that's relevant to, unfortunately, the northern part of Canada. So every kid should stay in school until age 16, and at the population level, this would have a big impact 60, 70 years later. So the recommendation, obviously, ensure good quality education for all, including girls, some countries. Next one, please. Hearing impairment. So now we're in midlife, any age. If you have hearing impairment, you should fix it. Don't be shy about wearing hearing aids because it's a 7% weight. It's big potential modifiable risk factor. The explanation why having impaired hearing would increase your risk of dementia is not quite clear, but you could think, well, you have less interaction with your environment. So social isolation perhaps is a factor. So it interferes with other things. Recommendation, make hearing aids available, affordable, and decrease noise exposure. That's important in the city, and also for people who are working in noisy environments or with powerful tools. Next, please. Now, this is the new one this year, a bad cholesterol. If you lower it with a statin, Zocor, Lipitor, Crestor-like drug, it does have an impact years later on the risk of dementia. We sort of knew this, but now it's official. So if you need to take one of these pills, go for it. And probably until age 85, but the guidelines for when to stop these pills will likely change over time. Ask your doctor, pharmacist, or nurse when it's time to stop. Next one, please. Depression. So this is a more difficult issue. It's been known that if you have depression before age 65, it's a risk factor for dementia. It's not a big weight. It's only 3%, but it simply means if someone has depression, it should be treated appropriately. It may require medications for a while. It may require psychotherapy, a change of environment. It will get better with time, obviously. So depression is a modifiable risk factor. Treat depression effectively at any age. Next one. Traumatic brain injury, we sort of knew that, especially because of football players who have recurrent brain injuries and they have a punch drunk kind of syndrome. It's a different kind of dementia than Alzheimer, but this could be applied to kids having head injuries in school, sports. If you're a cyclist, wear a helmet. So recommendation, wear a helmet or head protection in contact sports and on bicycles. Next one. Physical inactivity. So that's the big one, especially for Canada. It's not so important. The rest of the world, it's only 2% weight, but I'll tell you ahead of time that, yeah, it's a big factor in North America. So regular physical exercise, even if it's minimal, will change many things in your health. But now it's confirmed that it will reduce the risk of cognitive decline and dementia. So the recommendation, encourage exercise, because people who participate in sport and exercise regularly are less likely to develop dementia. Next one. Diabetes, that was known, and it's a low factor, 2%, but it's sometimes combined with high blood pressure and bad cholesterol. So it could be one among other vascular risk factors. So type 2 diabetes is a risk factor, so the message is treated well over sometimes a lifetime. It's also part of general vascular good health, controlling your weight and doing physical exercise, controlling your weight, etc. Next one. Smoking. So again, old news, but it's reconfirmed that if you quit smoking any age, it will lessen the risk of dementia later on. There are suggestions how to make this happen. Helping people quit smoking is obviously the way to go. Next one. Hypertension. So that was known. It's a relatively low individual risk factor, 2%, but it's often combined with lack of exercise, being overweight, etc. So control of high blood pressure, and the number that's proposed is 130, top number, systolic, anytime over age 40. So if you need medication for blood pressure, take it. It will prevent heart attack and stroke and dementia. Next one. Obesity. So it's only 1% worldwide, but it's a lot more in Canada and the US. I'll come back to that. So even in midlife, being overweight is a risk factor for many things, but that now includes dementia. So message, maintain a healthy weight, treat obesity as early as possible. And of course, this will help prevent diabetes or control diabetes. Next one. Excessive alcohol. So that's a debate we are having in Canada. What is excess alcohol? It used to be 2 glasses a day. It's good. Not sure, maybe 1 is sufficient, but you don't have to drink every day. We know that too much alcohol is bad for many aspects of health, including brain health. There used to be thought that if you don't drink at all, it's not good, but actually abstinence is also good if it's combined with other healthy habits. Next one. Social isolation. That's a big one, 5%. And that's unfortunately applicable mostly to people late in life. It's well established that if you don't have enough social interaction, you do have a risk of a cognitive decline. We encourage people to do things with other people, like being part of a book club is better than reading books alone, as an example. So recommendation, prioritize age-friendly and supportive community environments. And maybe that includes housing and facilitate participation in activities. Next one, we're nearly finished with the list. Air pollution, that's a relatively new one. It affects mostly people late in life, but it's probably happening even in midlife, but it's more evident as you get older. And some countries like China, some cities like Shanghai and Beijing, when there's increased air pollution, lots of older people get sick and die. So it's becoming a worldwide issue with forest fires. So reduce exposure to air pollution. It's one other reason to help our planet. Next one. Visual loss. This was it's like decreased hearing. You lose interaction with the environment. This is the second new risk factor that was brought up. It's quite prevalent. Many people have cataracts, so it's been shown in some studies in the US that if you have cataract surgery, you reduce the risk of dementia. So treat visual impairment properly. It will help many aspects of your life. Next one. So these were the modifiable risk factors. There's 14. I suspect there'll be 2 more in 6 months or so. One is sleep habits. How much sleep do we need? And the other one is gum hygiene. There's a lot of bugs in our mouth, and they may go into your brain or stimulate inflammation across your body. So there'll be additions to that list. But there are risk factors that you cannot change, like age. Everybody wants to live a long time, but there's a price. It is true that over age 65, you have a high risk of dementia. What we hope is that if you modify those risk factors through midlife, you will delay by 5 to 10 years the onset of cognitive decline. This is a strategy that's been proposed by Dr. Khachaturian 10, 15 years ago. Next slide. Sex and gender. Yes, unfortunately, women are more likely to get dementia, and it's not just because they live longer than men. We're trying to sort out, we being people at McGill and elsewhere, what's the biologic impact of being a woman. We know there's ways that Alzheimer's disease pathology is different slightly in women than men in terms of how the disease is progressing. And there's a note made that people who are non-binary, there's research also being done on that population. Next one. Genetics. So to make a long story short, there's only 3 genes, PS1, PS2, APP, that cause Alzheimer at a young age, like 30 to 45. This is less than 2% of people worldwide with Alzheimer. The other gene that is more common and important is ApoE4, which is probably 15% of the population having a copy of that less effective gene, less effective to carry cholesterol into the brain and into nerve cells. There's other weaker genes playing a role. Most have to do with lipids and inflammation processing by the body. Perhaps a combination of them plays a role, but it's not so much of a genetic disease except for those 2% of people with familial Alzheimer's. Next one. So what do these findings mean for us? So there's new evidence that 14 factors are at play that we can modify at the population level. There is a study starting in Canada, led by Dr. Anderson at the Rotman Institute in Toronto, to see if we can individualize these risk factors for people interested in prevention. And more about that, perhaps by inviting Dr. Anderson to present her work. Reducing these risk factors could have a huge impact. It's reducing the risk by half. There may be other factors, as I mentioned, such as gum hygiene and sleep quality. It's difficult to show that if you modify half or more of these risk factors, you have a big impact on the number of people with dementia. You need large studies over a long time. There's some examples like fingers, which started in the Scandinavian countries. There's an equivalent study that was done in Canada called Synergic. There's a discussion in the UK about brain health clinics, which is a concept where individuals would go, like you go for heart disease prevention at age 40, you would go at age maybe 50, you get your brain health checklist, but then you have to show it's worth the cost for society to pay for this. There are individual programs. I'll just mention a couple that may be familiar to some of our audience, such as EPIC, led by Louis Bérère, combining physical exercise with cognitive training. There's a program called MOCA Plus, led by Sylvie Belleville at the Institut de Gériatrie de Montréal. There's initiatives, especially in Toronto and across Canada, new initiatives, as I said, to individualize the approach to treatment. So it's still a potential risk reduction, but we need to prove it's worth it because there's cost consequence. So if you invest on risk reduction, do you save money by having less people with dementia, or people have dementia later in life and they die of something else? So it's a positive message. It has impact on our individual decisions about risk factors, and there's going to be more efforts, perhaps at the society level, to use this as a health strategy. Thank you for your attention.
Dr. Gauthier, thank you so much for this very, very interesting and important presentation. And I feel like, all of these risk reduction strategies are similar to, what's good for the heart is good for the brain. And it all makes so much sense. But I feel like education of public needs to begin at a much earlier age. I remember being in elementary school and learning about Canada's food guide and what's good, how do we keep ourselves healthy. I almost feel like these strategies should be introduced beginning to children at the age of 12. Would you agree?
Yes, in principle, it's just that we need to prove that modifying these risk factors actually has a big impact for the society as a whole and for individuals who are at higher risk. So maybe it's more in midlife that we can actually have an impact, because people are used to now have a heart checkup. So it would be a brain checkup. I think that's doable now with the evidence we have. And my hope is that we can start with a checklist online. And but then what do you do about it? If you find, I have 7 out of 14 risk factors, what's the best way to deal with them? So as a society, it will probably boil down to provincial and eventually to regional approaches to care. So that's why I'm so optimistic about the Toronto approach. I just found out this morning that they have this initiative to personalize the approach. And I'll just add that there will be blood tests to complement this assessment of risk based on your medical history. We're very close to have a simple blood test to say, is there already protein associated with brain aging leaking into the blood? And that would be a powerful motivation to say, exercise and lose weight and this and that.
And I find a lot of the points mentioned really need to be taken seriously. And I find in certain cases, there's some stigma. So for example, if we talk about hearing loss, a lot of the families that I work with, there are individuals who at a certain age start experiencing hearing loss, but people feel embarrassed to wear hearing aids. They don't want to hear about it. How many times, literally, they don't want to hear about it. I hear from my, some of the clients of mine that, my mother, my father, they refuse to get a hearing aid. But it really needs to be taken seriously, because the whole aspect of becoming socially isolated by not being able to participate, right? So, I think that that's an important one. The other one that I found surprising this year was the LDL cholesterol. And I really want to put emphasis on my generation, people that are in our 50s. I've been taking Lipitor for the last few years. And I remember when the doctor said to me that I needed to take this, I was like, what do you mean? Like, I'm in shape, I'm slim, but it's genetic, right? And a lot of my friends are now having to be prescribed this, and everybody's like, I don't want to take this medication, I'm too young. And I think what the report demonstrates is we need to manage our health conditions regardless of our age.
Indeed. I think this puts to rest also the debate whether it's safe to take Lipitor-like drugs if you need them. Mm-hmm. If you need them, if you tolerate them well, you take them for a long time indeed. The lowest effective dose to correct the LDL levels, and then you're on it until probably age 85.
Mm-hmm. I'm surprised though that sleep did not make it on the list, because there's been so much studies done about the lack of sleep and the correlation between dementia. So are you confident it'll make the next list?
Yeah, it will make the next cut. It's harder to study. You need special facilities. It has to be not just in 2-3 big cities and 2-3 big countries. They try to really make an effort to reach lower and middle income countries for these risk factors, and that's a little harder for sleep. Gum hygiene, I'm really hopeful they'll find evidence, because it makes sense. I don't think we take care of our seniors' hygiene when they're living in the residence, and it makes sense that chronic inflammation, whether it's local or systemic, also is a factor in brain aging.
And just the last one is the one that always makes me a little bit leery is the one about less education, because, I've seen and I've worked with a lot of families whose, loved one develops dementia. These are professors and lawyers and doctors. And sometimes I'm like, is it really education that is a factor? But how about lifelong learning? I mean, if somebody may only have a high school education, but what's the benefit of lifelong learning then?
Yes. Very good point. As far as low education being an important factor, that's one of the oldest established risk factor for dementia, and that's at the population level. Yeah. As you said, for individuals, yeah, you can be a professor and still get Alzheimer at age 70 because there's other factors at play. Now, lifelong education is important. It's sort of built in with the social interaction, but you have to do things you enjoy. So whether it's playing bridge or watching movies, being a member of a book club, playing chess, you have to do something you enjoy. I remember studies done in New York 10 years ago, watching a play, but having someone to talk about it. It's better than going alone. Yeah, so it's part of not just learning, but also social interaction. Then there's cognitive training. That's a different topic for another day. You probably already discussed that with people that you've invited. So recently we published 5 years after you've had your training for memory, there's still an impact on the ability to answer questions on the famous MOCA test. So lasting impact after intensive memory training has been documented.
Well, Dr. Gauthier, thank you so much for being with us this morning and for really enlightening us on the new Lancet Commission report. And really, thanks again for being here with us.
It's a pleasure. Bye, everyone.
So this webcast is an initiative of the McGill University Dementia Education Program, which is funded by private donations. If you would like to make a contribution to our program, please visit us at mcgill.ca/dementia. And I would really encourage everyone to join our mailing list. You just have to subscribe. You can subscribe on our website, or you could send us an email at dementia@mcgill.ca to stay up to date about all the important programs and initiatives that we are doing. So thanks again, and see you next time.